The participatory aspect of the governance model is, to me, a really big strength of H2O, because it involves patients. It puts them at the core as equal partners, same seat at the table as everybody else in measuring and determining their outcomes, their health outcomes. Building trust in H2O, I think, relies on two factors. One is the ethical governance and the reassurance that it is built in a way that fosters value and trust. And then the second is really walking the talk and delivering on the promise of better reporting, better involvement, better outcomes for patients.
No one knows healthcare better than the ones that are living it, which is the patients. Basically, the stakeholder trust is vital. And stakeholder trust is gained by being very clear on the charter of what H2O wants to achieve. Being transparent, not only in the governance, but in the outcomes and the benefits. Who's going to benefit from what?
H2O will only succeed if we build trust with society. And the way to build this trust is through our governance model. So what we are saying is that we need to create the governance that will allow all stakeholders to come together and in that way ensure that everybody's voice is equally being heard. And the idea of having all the multi-stakeholders together is that they will have to find a consensus. They will have to agree to what is really important for all of them. And I think history has shown us again and again that you can only achieve enduring change if you achieve consensus among stakeholders.
Health data are an essential resource because if we do medicine, then it is about health. If you think of health and the healthcare system as a science-based system, then obviously science means not just qualitative science, it means empirical science. And so you need to measure the outcome. And I think the health data are also in another way important because it has the potential to transform medicine. Why? It has the potential because if you say health, instantly says you're looking from the patient perspective. Because otherwise you're thinking of disease. So if you are treating diseases, then you have disease parameters as outcome parameters. If you think of patients, you think of their health.
So health data should be seen as an essential resource because they are really transformative for healthcare. Like the slogan, data saves lives, I think it's so important in the future that we have a good system how healthcare data can be collected and shared for all the stakeholders who have a legitimate interest.